Good afternoon. I'm Dr. Bonnie Henry, Provincial Health Officer for British Columbia, and this is our COVID-19 update for today, Monday, September 28th. I want to start by acknowledging that I'm on the traditional and unceded territories of the Lekwungen-speaking people, the Songhees and Esquimalt First Nations, and we're very grateful to be here on these lands. So for today, we're reporting on 3 periods. From Friday to Saturday, we had 68 people diagnosed with COVID-19. Between Saturday and Sunday, we had an additional 125 people diagnosed with COVID-19, and Sunday to today, another 74 cases, bringing the total for the weekend to 267 cases, new cases, 10 of whom were epidemiologically linked, bringing our total in British Columbia to 8,908 people with COVID-19, including 3,226 people in the Vancouver Coastal Health Region, 4,555 people in the Fraser Health Region, 206 people in the Vancouver Island Health Region, 531 people in the Interior Health Region, 303 people in Northern Health, and 87 people who normally reside outside of Canada. We are now at 1,302 active cases in the province in all health authorities, and we have, of whom 69 people are in hospital, 22 of whom are in critical care or ICU. And that includes 32 people in hospital in Vancouver Coastal, plus 1 person who is from outside of Canada, 30 in the Fraser Health Region, 1 person in Interior Health, and 5 people in hospital in Northern Health. We unfortunately, sadly, have had 3 new deaths from COVID-19 over the past weekend, bringing the total number of people who've died from COVID-19 to 233. And these are 1 person each in the Fraser Health Authority, Vancouver Coastal, and on Vancouver Island. And as always, we are affected deeply by these deaths and by the families and the caregivers and the communities who are suffering and grieving, and we send our condolences to you. There are 3,372 people now under active public health monitoring and 7,346 people who have recovered from COVID-19. Over the weekend, we've had 3 new healthcare outbreaks. One a recurrence in the Holy Family Hospital in Vancouver Coastal Health, Neighborhood 1 and 2, with a single staff person, and a single staff person as well at Thornbridge Gardens in Fraser Health and Harrison West at Elm Village. The outbreak at Burnaby Hospital, on the other hand, has now been declared over, leaving us with 16 active outbreaks in our healthcare system, 837 total cases, 494 residents, and 335 staff. Additionally, we have 1 new community outbreak that's been declared in the Interior Health Region, with 5 cases related to an event at the Calvary Chapel Church in Kelowna in Interior Health. I would also encourage people to check health authority websites for alerts and notifications. And I do want to make the point that all health authorities now are consistently posting any school exposures, and we can be confident that they are posted up there so that everybody knows where these exposures events have happened. I know, like me, many people would like to see the number of new cases and clusters go down, particularly as we watch what is happening across the country and around the globe as increased in cases are happening in many places. We can all influence that. Contact tracing has shown that the main source of COVID-19 transmission in British Columbia now continues to be through events where we're socializing with others, whether in a private home or a less controlled setting. We know that important ceremonies, important events like weddings, birthdays, funerals, and parties have been driving this in the last few weeks. What this means is that through the choices we make, we can control the course of the pandemic as we're moving into the fall. Whether the curve goes up further, stays the same, or goes down relies on us. The best thing we can do, all of us, is to take a step back from our social interactions right now. I'm asking you to travel less, to see fewer people, to stay with your household and your safe six, and connect with others, the other important people in your life, virtually. You can make a difference by making these safe choices now in how you spend time with others. We need to remember to go back to our standing together by staying apart and connecting virtually. We do know that we can make a difference, and we need for our community health and wellness to continue to have our businesses going, to have people going back to work, and to have our schools open. And all we have to do is look around at the many, many places that are doing this and doing this safely to know that we can do it as well. We've shown that by using our layers of protection, whether that's plexiglass barriers, whether that's reducing the numbers of people in a grocery store line, whether it's having those barriers and distance in place in restaurants, can keep customers, colleagues, and our communities safe. Let's take a moment to appreciate this and recognize that we have many things open in our community now, and we can continue to have our communities functioning safely as we go into the fall if we all take a step back and do our part. We need to appreciate these shared successes and use that to energize each other in the months ahead. It isn't always easy to say no to seeing friends or family. We know that. We know that we are social creatures, and having that social connection is important for all of us. It can be a difficult choice to make. But if you see family or friends putting themselves at risk, we need all of us to encourage and support people to do the right thing right now. Here in BC and many other places, we have seen examples of events that we call super spreading events, where somebody passes this virus on unwittingly to large numbers of people, and they can take it home in turn to others. We don't know all of the details around it. We do know that it's most likely to happen when we have large numbers of people who are in close contact, whether it's sharing food and drinks and kissing and hugging or talking loudly, singing. Those are things that we know can transmit this virus even when we're outside, but particularly when we're inside enclosed or crowded spaces. And we do know that sometimes some people are more likely to shed a lot more of the virus than others. And we don't understand yet why some people do and some people don't, and we can't always predict ahead of time. So we do know what we need to do to protect ourselves. We have seen our way through this pandemic, and we can do it again. That includes making sure you know when you're making your decisions whether or not to see others, take a moment to think. Think about the risks you're going into and the risks that you'll bring with me if you do leave, when you do leave. This week, I invite you to join me and take a moment to reach out to the seniors and elders in your life, your friends, and your loved ones who may be at risk. Let them know they are not alone, and in the weeks ahead, show them you care by staying connected to them virtually this fall. Living with COVID-19 is about finding that balance that will keep our communities strong and everyone, whether at school, at work, or at home, as safe as we possibly can be. Let's keep our communities healthy and strong by staying small, staying home, and staying safe. And of course, let's continue to do it by being kind to each other, being calm, and being safe. Thank you, and I'm happy to take questions. I just will note that our usual report on PPE and the procurements of PPE will be attached to the statement that will be released later this afternoon.
Thank you, Dr. Henry. As a reminder to everybody on the phone, please press *1 to enter the queue. You are limited to one question and one follow-up only. I would also ask that you please take your phones off mute. You will not be audible until I call your name. First question is from Richard Zussman, Global News.
Dr. Henry, I would like to ask about schools. We've heard a few different situations at high schools across the province where students have been gathering at local convenience stores or local restaurants and are mixing cohorts in some regards, and also potentially, touching things and potentially being exposed to the virus there. Are you concerned about this sort of activity that's happening sort of at lunchtime and during break times of the school day?
Yeah, we're all adjusting to what the new school looks like, and I know it's very different particularly for teenagers, and that strong urge to be socially connected at that time in our lives is a very challenging one to overcome. But yes, now's the time where we need to stay small, and it will not be forever. And sometimes when you're a teenager in particular, it does seem like it's the end of the world. But I also know that young people are very resilient and very adaptable. And so now's our time to support each other in keeping those groups small, knowing that that is important so that we're not spreading it to each other, but also not bringing it home to our families, our loved ones, our grannies, our aunties and uncles. Those are important things, and I know young people believe that as well. So now's the time, we're getting over the novelty of how this is going to work, to put in place those rituals, those procedures, so that we can safely go back to school, continue the learning and the connection that we have, and not have those potential exposure events outside of the school setting. And there has been some transmission in groups of children, young people who have been hanging out together outside of the school setting, and it affects the whole school community. So parents and young people, let's support each other to stay small.
Richard, do you have a follow-up?
Also on schools, Dr. Henry, there's one case of a school, I think in North Vancouver, that's had a few classrooms that have been shut down due to concerns about COVID. Is there a number in your mind in terms of classrooms in a school that would shut down to create the entire school being closed? Or in what situations do you provide advice that an entire class should be asked to isolate? Or are there guidelines for that?
There are indeed guidelines for that, and we're following them in public health across the province. So what we have are exposure events, and we've had quite a few of those, not that many compared to the number of schools that we have. And there has been no transmission events or outbreaks in schools yet that we've seen, so that's good. But we also look for where people have been infected, where they've been exposed, and what type of exposures they may or may not have had in the school setting. So it is very likely that children who are in the same classroom may have had the same exposures. There's also exposures in the community that people bring with them. And so health authorities in all across the province will follow up individually with anybody who's had a close contact with somebody who has tested positive for COVID-19. And in some cases, small numbers of children have been asked to stay home from school. But it would really depend on the situation. And I would encourage parents to recognize that exposure events do not mean that your child has been exposed to COVID-19. Unless you've had a call directly from public health, you don't need to worry about that, and we are being very transparent in putting up where those exposures might have happened so that everybody knows that public health is on it, and that we're working with you, and that we're working with the school, and that we know who needs to be isolated and who doesn't. So that's really important. Just because there's been an exposure event does not mean you need to keep your children home. If we have an outbreak, it may mean that the whole cohort may go home. The only time that I could see that a school would close is if too many of the teachers or staff had been exposed to each other or become sick, and the school couldn't operate safely. So there's many different scenarios that we could look at, but for the most part, what we see are very limited exposure events and very small numbers of people who might have had close contact either in the school or outside of the school environment.
Next question is from Tina Lovegreen, CBC.
Thank you so much. Hi, Dr. Henry. I'd also like to ask a question after we heard from several North Shore parents about concerns over how close contacts are identified and who is tested. So how is someone determined to be a close contact when there is an exposure in schools? And why not tell the entire class or cohort, given that kids often play with other kids? And so why not ask health authorities to contact everyone in the classroom automatically, including the teacher if there's a positive case?
Yeah, we often have a really good idea of where people have been exposed and what type of things that they've been involved in that are risky or more or less risky. We've been doing this now, as you know, for some time. So the health authorities are very good at determining that, and we have criteria for when somebody has had close contact. So it has to be for a period of time within a certain setting, whether outdoors or indoors, and the types of risks that we see with those types of contacts. And absolutely, the health authorities follow up with the schools, they follow up with the teachers, and they get the information they need to make the risk assessment for that individual case. And we can have confidence that we're doing that consistently across the province with every single case.
Tina, do you have a follow-up?
Yes, please. We've also heard that there were cases where the siblings were told not to isolate and go to school. Some even told they don't need to get tested, but the parents decided to go against the public health advice they were given by 811, fake symptoms, and actually get their children tested, who actually ended up testing positive. So given that we've heard, of these asymptomatic cases, that have ended up testing positive, any plan to change it that everyone in the household has to get a test when there's a positive case in the family, and whether they should all have to isolate?
Yeah, so we test people for the most part who have symptoms, even children. And we know that that's how most people are identified. When somebody is a close contact, there are situations, and certainly in household situations, where we do recommend that people all get tested. But those will be determined depending on the type of exposures, the type of transmission that we're seeing. And we do that in some communal settings. We do it in long-term care, for example, as well. And I think we need to be a little bit careful about, there's lots of rumors and information that's going around, and sometimes it gets misinterpreted, or it may not be exactly what we think it is. And we have to find that balance between protecting people's privacy and making sure that people are aware of what's happening in our communities. And I think we're working through this as best we can to support people in doing that. There are certainly situations where people should be tested, whether they have symptoms or not. But for the most part, if you're a contact and a sibling of a contact, then no, you don't need to stay home. You don't need to be tested. And but what I encourage people to do is take the advice of public health and take the advice that you're given from 811.
Marcella Bernardo, News 1130.
Hi, Dr. Henry. Still with school situation, there seems to be a lack of confidence, as we've been hearing this afternoon, in safety protocols in schools, considering how many kids are already going home with a cold. So if we can't protect these kids from spreading the sniffles to each other, how can we possibly expect them not to spread COVID-19?
Yeah, well, the sniffles happen a lot, and there are some viruses that are more infectious than others. And we know the common cold viruses do spread very easily from a variety of different ways of transmission. It's not the same necessarily as the spread of COVID-19. But it is a reminder to us all of how important it is to do those basics of washing our hands regularly, covering our mouth when we cough, making sure we're cleaning our space, making sure we're keeping our distance, and if we're not feeling well, to stay home.
Marcella, do you have a follow-up?
I do. You've mentioned that you don't want people to be talking about rumors and things like that, but we're hearing from parents that are being sent essentially hush letters where they're being told by health authorities and by the schools not to share that information with others. And that kind of goes against the commitment of transparency. If parents are being told that there might be an exposure in their child's school, why wouldn't you want them sharing that information?
Yeah, and that information is being shared and it's being posted publicly, so everybody is aware of what schools we've had exposure events. We'll also be publishing or posting if there's an outbreak in a school. We'll be putting that information up, and I don't believe that there's been hush letters, as it were. We do ask people to respect other people's privacy around specific individuals and not sharing information perhaps about their own individual situation. And we do reassure people that we're not going to be telling the rest of the school or the class about your child or your family interaction. So I would just encourage people to look at the websites, to be in touch with your principal, your school, to make sure that you have the information that you need and that public health will be there working with every school on this.
Next question is from Cindy Harnett, Times Colonist.
Thank you, Dr. Henry. Families advocating for changes to the visitor policy in long-term care homes, they'll rally tomorrow on the lawn to the legislature. They want essential visitor status, as is granted in other provinces. In BC, they say the health orders permit it, but the decision is left to facilities that most often deny their requests. Do you foresee greater guidance to seniors' homes on the issue of essential visitors?
Yeah, you know, this is, of course, a very challenging issue that we've been working on for some time, and we do have guidance. It is being updated and revised. As you know, part of the challenges are having sufficient staff to support visits, and in all long-term care homes, we have, as you know, defined the essential visitors and who can be indicated as an essential visitor, and we want very much to increase the numbers of people that an individual can have visiting them. I think we need to be cautious again. You know, we've seen in Quebec and Ontario in particular that they did expand quite a lot, and they're now starting to see larger outbreaks in their care homes. It is a very challenging thing for us to find that balance, and we will and continue to modify and look at how we can support families to be with their loved ones in care homes. I appreciate how challenging it is right now.
Cindy, do you have a follow-up?
I do, thanks. This is from my colleague, Cleve Deanshaw in our sports department. He's asking, why is it that team-on-team competition that was restricted in Phase 2 is allowed in Phase 3, but only for community sports organizations? It means, I guess, that student athletes are playing in community sports leagues, but not allowed to do so in high school or school leagues. High school coaches interviewed are frustrated. Via Sport says the school sport is under the Education Ministry, but the Education Ministry said it can't comment amid an election campaign. Can you shed any light on what, if anything, will improve or become more restrictive headed into the fall?
Yeah, no, we are looking at having school sports, but they will be limited in the same ways that we've been limiting some of the community sports. So it would be schools playing teams within the region, not traveling around the province as normally would happen, and there'd be restrictions on certain sports. I mean, sports like wrestling are not ones that we're going to be able to do safely this fall. There's some others as well. So we are looking at, and it is part of the school reopening plan. We are taking things in a stepwise fashion. So things like running and some of the sports teams will be going in some communities, but it is again depending on the school district and how they're able to manage that. So I don't have all of the details, but I do know that it's an important part of how some students are their learning capacity, and sports is a very important part of keeping young people fit and active.
Next question is from Moira Witten, the Tyee.
Good evening, Dr. Henry. Thanks for taking my question. Last week in your briefing on Thursday, you mentioned that the BC CDC was involved in some of the work to implement your order around expanding safe supply prescribing power to nurses and the government's directive as well. Could you talk a little bit more about what specific role this BC CDC is playing?
It was actually the BC Centre on Substance Use that I was referring to, not the BC CDC, although the BC CDC does have a role in our supporting our harm reduction programs and other things across the province. But the BC Centre on Substance Use has the expertise and clinical expertise to support developing the tools and the training materials for nurses, and they are involved, actively involved now in doing that with the College of Nurses and with people with experience in the field.
Moira, do you have a follow-up?
No, thank you.
Thank you. Next question is from Mary Brooks, Island Social Trends.
Hello, Dr. Henry. Thanks for taking my question. I'd like to ask about the accessibility to COVID testing. In Ontario, they've started making that service available to people at pharmacies if those people are thought to be asymptomatic, and apparently they're pre-screened over the phone for that. Do you see that sort of service being available in BC to help with the backlog or overload of testing?
Yeah, we've been looking at this. As you know, Ontario and Alberta and a few other provinces had done a lot of asymptomatic testing in people who didn't have exposures, and in those situations, the yield, as we call it, was very, very low. So it did not increase our ability to find cases or clusters or outbreaks or manage and control in our community. Here in BC, we've always been focused on making sure those people who actually need a test have it and have it available, and it has been challenging. I know there's been challenges with some of the phone lines and with some of the clinics, and we've also had challenges with accessing reagents. So one of the things that we are thankful for that Ontario has moved to this, Alberta has also moved to reduce the amount of low-risk asymptomatic testing they're doing, because it used up a lot of the reagents that we all needed across the country to do this testing and focus on the people who have a risk. So we will continue to focus on people with risks of exposure, risks of infection in BC. We have been looking at what are some other ways that we can reduce the lines in our clinics and increase our capacity in the back end in the lab to do the testing. One of the things that we're doing, of course, is using the swirl and spit test, which will help because people can do it without a healthcare worker. We're also looking at some of the tests that can be the more rapid point of care tests that might be helpful for identifying quickly if we have an outbreak in an area. It is all under flux. We had actually another hour-long conversation about it earlier today. So we are looking at, as we've said many times, trying to increase our capacity to test to up to about 20,000 tests per day, and is a challenge that has many different facets to it. So having people go to a pharmacy is not off the table, but it's not what we're focusing on right now.
Do you have a follow-up, Mary?
Yes, I'm wondering, like a lot of people, about Halloween, and if you have those guidelines coming and any sort of early ideas for people who are planning their decorations, costumes, and parties.
I shouldn't be surprised maybe, but I have been receiving many questions about Halloween, and yes, we have been working nationally on some guidance, and it should be finished later this week, and we've been adapting it here for BC. So things that we're looking at are, we cannot have those big parties where lots of people are getting together, whether it's young people partying in costumes or whether it's the trick-or-treating. So we have advice to people about how to do that in a safe way. So outside, small groups, not requiring people to sing for their treats. Having things pre-packaged in ones so that children can come one at a time, those types of things. We've also put in some guidance for people who, having a Halloween party is a really important thing for them. Again, small numbers, outside, over time, how to do things in a way that doesn't bring people together inside. One of the nice things, of course, with Halloween is that mask wearing is often part of it, so we would encourage that as well.
Next question is from Jane Side, North Shore News.
Hi, Dr. Henry. I have questions still about the school situation. I'm still a bit concerned confused, and I think maybe my confusion is shared by some parents that I've talked about the cases that are being posted publicly by Vancouver Coastal Health. Is it the case that they will be posting anytime a person from the school community has tested positive, or anytime that person has been confirmed as being in the school while they could have been infectious, or is it only when you can't identify close contacts?
Yeah, it is across the province. All health authorities will be posting exposure events. So that's somebody who's tested positive, who was in the school environment during their infectious period. So when they could have potentially exposed others. We know, and we've seen this in June and again in the last couple of weeks, that we have had teachers and other staff who have been exposed in their family or a social environment and have not been at school, and children as well who've not been at school at any point during their infectious period. They were detected at home and had been away from school. So those are not exposure events, but across the board, and in Vancouver Coastal as well, any exposure event, anybody who's tested positive who was in the school during the period when they were infectious will be posted.
Jane, do you have a follow-up?
I do have one follow-up, also related to schools, which is the question that I've been getting from parents. Why is it okay for siblings of children who are self-isolating at home to go to school, given that those kids have probably had a lot of close contact before the self-isolating began?
So it depends a little bit about why they're isolating. So if they are self-isolating because they're a close contact of a case, then their siblings are a contact of a contact, we call it. So they're not at risk. If their sibling develops symptoms or illness or becomes test positive, then they are at risk. So while one child is self-isolating because they've been a contact, we want to minimize the contact that the other children have with that child. So that's part of making sure that we're protecting the rest of the household if somebody has been exposed. So we know that when you've been exposed, not everybody will get infected with the virus, and it depends on the risk setting that you're in as well. And we know that it can happen over a period of 14 days, the incubation period. So when we ask somebody to self-isolate, we have unfortunately right now, we still don't have any medications or a vaccine that can prevent somebody from getting sick if they've been exposed to enough virus. But on average, in most settings, people only transmit to one or two other people, even in close families. Less than 14% of the families that have been measured when we've had clusters in families. It's not everybody that gets transmitted. So if somebody has been exposed to a case and they're in the incubation period and they're self-isolating, we want to make sure they're staying away as much as possible from other people in the household.
Next question is from Claudia Van Emmerich, Global Okanagan.
Hi, Dr. Henry. Thanks for taking my question. I wanted to follow up on Richard Zusman's question about students gathering, particularly on lunch breaks and popular hangout spots, in front of convenience stores, that kind of thing. We've received some troubling video into our newsroom, as well have witnessed it firsthand ourselves, of a large number of students gathering at these popular hangouts during lunch breaks. We've witnessed, zero social distancing, the majority of these students not wearing masks. And we're talking about, a large number of students. The government has spent more than $45 million implementing safety measures to keep everyone safe. Do you feel like those efforts are being spoiled during these breaks? And can anything be done to prevent it?
I think this is where my message to all of us is now's our time to make a difference, in protecting our communities. And that means young people as well. They may not be watching me, but I encourage all the influencers out there to talk to your friends, to make sure that you those are not the things that we want happening right now. So parents, talk to your children as well. This is important for protection of all of us. We do know that young people are less likely to have severe illness, and it can be very challenging. And I empathize with teenagers in particular. Who wanted this at this point in your life, where there's so many important things that you're trying to do around social connections? And I know it's challenging, but it's not forever. It is for now, and we need to be adaptable, and we need to support young people in doing the right thing. And we can help the places that people are going to. We need to have conversations with young people in our lives, and help them find other ways of having those social connections without gathering together.
Do you have a follow-up, Claudia?
Just a very quick follow-up. Because this is happening off school property, the school district obviously can't do a whole lot. I guess what role parents play? Are parents responsible for really, instilling that message in their children to physical distance and wear masks?
Well, I do absolutely think we all have a role as people in our community, so parents, grandparents, but also in the school community. We can give those messages to kids, to young people. We can help them understand the importance of it. And, we don't want to jeopardize the school year. We know that the school environment is so important in many different ways for young people and for children. So, this is something we all need to do together. It's on all of us to take those actions, to support each other, to find ways to allow those necessary social interactions without putting us, our communities and our families at risk.
Brishdi Basu, Victoria Buzz.
Hi, Dr. Henry. Thanks for taking my question. I'm just looking for more information on the person who died in the Vancouver Island Health Region. Are you able to tell us their age, gender, and whether they had any underlying health conditions?
This was a man in his 50s, I believe, or 60s, who did have underlying health conditions and unfortunately died in the community at home, and was identified as being positive for COVID after his death. So very disturbing and tragic for his family, and our condolences go out to his family and his community.
Do you have a follow-up, Brishdi?
Yes. It's a slightly different question, but is the fact that Vancouver Island, much like New Zealand, is somewhat isolated from the mainland a factor in the fact that we've had fewer number of cases and outbreaks here?
I think probably, although we do have lots of people that come back and forth on the island, and we're not immune to it, as we've seen. It sometimes is unrecognized. We've been lucky in some ways as well, where we've had people who have come back to the island with COVID and have not spread it to large numbers of people. Despite sometimes there's been parties and other things that are going on. So a little bit of it is luck, a little bit of it is people paying attention and doing the right thing. And, we do have an older population in many communities on Vancouver Island, and I think people are taking that to heart. We also have a very strong public health team that's working with our communities across the island. So I think there's a number of factors. But I hope it holds. We all need to continue. We can't get complacent anywhere in BC, because we are seeing that people are bringing this with them unintentionally, for the most part, unintentionally, of course. But we bring risk with us when we go other places, when we go to events, when we go to parties, when we go to social interactions with people.
Sandy Hall, CFAX 1070.
Thank you. You've already answered one of my questions. I would like to know about about Thanksgiving. It's 2 weeks away. We're going to see an influx of people coming in from other provinces, and I'm wondering, where are most of our new illnesses coming from? Are you able to say?
Most of them are community clusters, as I mentioned. We know that many of the transmission events that we're seeing now are from social events and people getting together. And I would say Thanksgiving is an important time for us to connect with our family, with our loved ones. Anything, giving thanks is incredibly important. And in this year, as as much as any year when we've all come through this, but we need to do it in ways that are safe, particularly for our older family members, for people who are at risk of having severe illness from this. So now is not the time to have the family gathering. Now is the time to have your small, local, nuclear family together and to connect through Zoom, connect through virtual means with the rest of your family in other parts of the country. And we're seeing that message in places where we're seeing this virus take off again. We know that it can take off if we're not careful, if we have those connections with people. And we don't want to put our loved ones, our elders, our seniors at risk. So this Thanksgiving is one for us to give thanks in a way that keeps everybody safe.
Do you have a follow-up, Sandy?
Yes. So can you name which provinces you're more concerned about people coming from?
Well, we have not had many cases in the Atlantic region right now. We've also had very few cases in the territories. But as we know, areas in Ontario and Quebec have seen dramatic increases recently, particularly in around the Montreal area and Toronto area and some other places as well. We've also seen increases in Alberta, in Manitoba, and here in BC. So we all need to do our bit. Now's our time to go back to staying close to home, staying with our nuclear household, our family bubble, and giving thanks that way.
We have time for one more question this afternoon. As a reminder, Dr. Henry will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca for medical guidance on protecting families and communities, and for access to provincial guidance on COVID-19, visit bccdc.ca, and for information about the province's pandemic support, visit gov.bc.ca/COVID-19. Last question is from Keith Baldry, Global News.
Oh, hi, Dr. Henry. Thanks for this. Just wondering, checking the Center for Disease Control's weekly surveillance report shows that the hospitalization, people ever in hospital for the last 2 months, the growth rate is about 3 times that of the previous 2 months. I'm just wondering if you could put that in context. Is that something that's of concern, or is that something that was expected?
Yeah, we knew. It's what we call a lag indicator, so it tends to follow when we started to have increased numbers of cases, and we have had, as you know, increased numbers of people being affected. And when we start off with the younger age group, but we know there's spillover, and that's where about 2 weeks ago I started to tell people we needed to start pulling back, and because we were starting to see spillover into older people, into people who are into long-term care homes again, and that's reflected in our hospitalization. It has not gone up incrementally, it's gone up more linearly. So while of course we're concerned, we're not at the point where our services are stretched, where we need to worry about being able to have resources. But we need to all pay attention to that. We need to pay attention to it because the more people end up in hospital, the more risk we have to others who are going into hospital, the risk we have to our surgical restart, which is going full blast right now, and the risk we have to our community. So we do need to flatten our curve. That is important, and that will bring our hospitalizations down over time as well. Those are the key things we need to focus on in the next few weeks.
Do you have a follow-up, Keith?
Yes, another sort of statistical analysis one. The positivity rate that's on the dashboard every day has been coming down. It was hovering around 2 for a little more than a week. It was up as high as 8, I think, back in March or April. Now it's 1.1, 1.3. How should we read that? What does the positivity rate tell you of what's going on?
Yeah, and that's in the context of we're doing a lot more testing. It tells me that we are testing the people who need the test, and that we still have relatively low rates of transmission in our community. That's important. The other metric, in and of itself, it's one of the things we watch, but we watch hospitalization rates. The other thing I'll note is that our hospitalization numbers have come down, and our rates, so the percentage of hospitalizations over total cases has also come down, which told us back in March and April that that we were detecting people who ended up in hospital. So we had about 20% of cases ended up in hospital. We're now around 6%, 6, 7, 8%. So that tells us that we have a larger number of younger people who aren't needing hospitalization, but it's starting to creep up again. So again, percent positive is something we watch. It's one of those metrics. If it's above 5% in some, according to some people's statistics, that tells us that there's transmission in the community that is concerning. We like to see it lower, because that tells us that we're finding people with the strategy that we have for testing, where people are tested if they've had an exposure or they have symptoms. So we know their pre-test probability is higher, that we're testing the right people. So yes, it is something we're watching. It's along with the other metric that we watch very carefully is those unlinked cases in the community. And right now that continues to be relatively low.
That's all the time we have for today. Thank you.
Thank you very much.